forward on this. Great. All right, Raven, you want to hit the button? Now is the time. Give me a thumbs up when it's officially streaming. Great. Okay. Well, hello, everyone. Welcome to the Science for Change series, a collaboration between the Free Library of Philadelphia and Skype a Scientist. We're super excited to have you all here because we want to learn about the problems broadly in society, how science has helped us understand what's going on with them. And then we're talking to community organizers and activists to understand what people are doing to make the problem better and what you can do, no matter what it is that you do in your day-to-day life, what you can do to make it better. Raven is our free library person. Raven, do you have anything you'd like to say?
Mostly, I'm glad for the opportunity to talk about this. I know that this is something that impacts Philadelphia specifically very heavily, and to the extent where by an interesting happenstance, some of our librarians have become quite noteworthy for administering Narcan in certain high use environments. And I know that there's been discussion about a lot of kind of public health initiatives within Philadelphia in regards to either needle exchange or supervised injection sites, all of which are fantastic for harm reduction that I'm really hoping that these initiatives really help with, and contributing to the narrative that would help with some of the stigma against some of these harm reduction techniques is something that I feel is really important, especially in Philadelphia, but also not exclusively in Philadelphia. This is pretty much any community that is impacted by these. This is an important narrative. And so I'm very glad that we have this opportunity to kind of shine a little bit more light on it.
Absolutely, yeah. This is an issue that's really important to Philadelphia, but not, like you said, but also important everywhere because this is a countrywide problem. But I'm going to stop personally talking about it because we have someone who really, really knows what they're talking about on this topic. Rachel, thank you so much for taking the time to be with us and share all of your expertise with us tonight. I'm going to hand it over to you. So for folks, to introduce Rachel, Rachel is a community organizer at Soul Collective, an organization that does a bunch of harm reduction and amazing work here in Philadelphia to help people in the city be safer. And so with that, I'm going to hand it over to you, Rachel. Thank you again for being with us today.
Awesome, sure. Thanks, Sarah and Raven and Ruth for all of your help in organizing this event, and really excited to be here. I will share my screen. And are you seeing an okay view?
Yeah, that looks great.
Awesome, perfect. So today I'll talk a little bit about harm reduction, what that is broadly, and kind of what that looks like in Philadelphia in the context of overdose deaths. And so as Sarah mentioned, my name is Rachel French. I'm a nurse and I'm a community organizer here in Philly with Soul Collective, and I'm also a researcher. And so I think it's helpful to kind of start off thinking about what harm reduction is. You may have heard the term. It's kind of increasingly being used in the context, oftentimes of drug use and overdoses, but it really can apply in a lot of ways. And so harm reduction is really a set of practical strategies and ideas aimed at reducing the negative consequences associated with drug use. And so we know that harm reduction is also a movement for social justice. It's really built on this idea of equality and equity. And it's also built on a belief in and respect for the rights of people who use drugs. And so harm reduction has grown out of the movement to support people who use drugs, and has really been sponsored by drug users themselves, and has been really, drug users unions and people using drugs have really been at the forefront of activism for harm reduction. But we can also see harm reduction in our everyday lives. This can be wearing seatbelts, It can be a lot of things that reduce the harm associated with things that we're not going to stop doing. And so what does it really mean to improve the lives of people who use drugs? And so just a few examples of this would be things like safe supply of drugs. So we know in Philadelphia, the drug supply is nearly completely adulterated with fentanyl, making it incredibly dangerous and the risk of overdose being very high. Having a safe supply of drugs would reduce lots of overdose risk, but is not something that we currently have in this country. Also, clean needles for people to inject is another harm reduction strategy that would improve the lives of people who use drugs. We know this reduces infectious disease transmission and skin infections, as well as serious infections like endocarditis of the heart that can be deadly. We also know that safe consumption sites or overdose prevention sites, like you may have heard of Safe House in Philadelphia, are harm reduction strategies that would improve the lives of people who use drugs. We also know that meeting basic needs like food and shelter and healthcare, those are things, harm reduction strategies as well. And really importantly, we also need non-judgmental environments where safety is prioritized for people who use drugs, something that often is not a given. And so what does harm reduction not mean? What does it not mean to improve the lives of people who use drugs? And a big piece of this is, really combating law enforcement or the prison industrial complex. We know these things are really propped up by the not legal nature of drugs and drug use in this country. And a lot of the issues that result from using drugs are not actually resulting from drug use itself, but really from the consequences that stem from those drugs not being legal. We also know that a treatment or recovery only model is not helpful for all people who use drugs. We know this model, models like Narcotics Anonymous, AA, like medication, those can be models that work for people, but not all people. So it's really important to meet people where they are. And also stigmatizing drug use really does not, it's something, stigma and bias, those are explicit and implicit things, and those really work against kind of the quality of life for people who use drugs. And so I think it's a really important question to kind of ask who uses drugs. I think we have a picture oftentimes of who we think of as people who use drugs, but it's really important to consider that lots of people use drugs. Politicians, celebrities, parents, people coping with various life events, people with prescriptions, people having spiritual experiences, college students, doctors. Anyone can use drugs, and many of us do throughout our lives. And I think this is really important to think about, especially in the context of maybe some stigma reduction. And so I think it's also important to consider what is stigma. And that stigma might, other examples in our society certainly exist of stigmatized and marginalized and minoritized populations. But I think people who use drugs especially suffer from stigma. And this is something that really actively works against efforts to improve the lives and reduce overdose deaths among people using drugs. And so the definition of stigma is a mark of disgrace associated with a particular circumstance, quality, or person. And just one example, a quote that I think is resonant is, "The stigma of having gone to prison will always be with me." And so I think it's also, as we think about stigma, these are just some guiding questions that I ask myself that I think are important to kind of ask ourselves as we think about how we can mitigate stigma at both an individual and systemic level. And so I'd like to shift now a little bit. So that's kind of a broad overview of harm reduction. But to think about the overdose crisis in Philadelphia, and as I think Raven and Sarah really aptly pointed out at the introduction of this talk, but so the overdose crisis exists across the country and also across the world. But today we'll talk a little bit about it in Philadelphia. There are certainly components of the overdose crisis that are unique to Philadelphia. And so in the next few slides, I'll show you 3 graphs that I think are really striking. They're from data that was released from the Philadelphia Department of Public Health in July of 2021. So relatively recently, just showing an uptick in overdoses in various groups particularly affected. And so this is a graph showing that number of unintentional fatal overdoses with drugs in Philadelphia from 2010 to 2020. And so as you can see, in 2020, over 1,200 people died of an unintentional drug overdose. And this is an increase of about 6% from 2019. So we know this is going up after, the peak in 2017, we're nearly back at that peak. And I think really important to note is that opioids with and without stimulants were detected in 86% of deaths in 2020, which is an increase. But you can also really see stimulants being really involved in a lot of these overdose deaths as well. And so stimulants such as cocaine and methamphetamine were detected in about 60% of overdose deaths in 2020. And so I think a lot of times we'll hear about the opioid crisis or the opioid epidemic. I think a really important reframe is to actually think about this as an overdose crisis. And oftentimes opioids are involved, but oftentimes other drugs such as stimulants are also involved. And deaths involving stimulants and opioids together increased from 6% by 6% from 2019 to 2020. And that's accounting for 48% of the 2020 overdose deaths. And so the second graph we'll look at here is the percentage of drug overdose deaths with fentanyl present. And this is stratified by 3 different groups. So it's all overdose deaths in Philly, opioid involved overdose deaths, and then stimulant involved overdose deaths. And so we can see that over time, fentanyl has been detected in greater proportions of drug overdose deaths. This is something that's true across the country. It's particularly true in Philly. It's been made worse amidst the COVID-19 pandemic. And in 2020, about 81% of all drug deaths and 94% of opioid-related drug deaths, 77% of stimulant-related drug deaths also involved fentanyl. So that'll give you a sense, over 3/4 of drug deaths, regardless of the cause, have involved fentanyl. So it's really the leading cause of overdose deaths. We're also, though, seeing fentanyl increasingly being detected in other drugs like methamphetamine, PCP, and really strikingly in pressed pills made to look like prescription opioids like oxycodone or Percocet. So they're counterfeit pills made to look like prescription pills, but those can oftentimes contain fentanyl as well, which is part of the spike in overdose deaths we're seeing. And I think also really important to consider is the race and ethnicity of people being impacted by drug overdose deaths. I think historically, the opioid epidemic or the opioid crisis was thought of as a fairly white suburban problem. And this was a narrative that we heard. It was framed as a sympathetic narrative, I think, oftentimes. And it really garnered attention from politicians and powerful organizations and people in positions of power to really care about the opioid crisis at the time. But I think we've really seen an evolution of who's affected by overdose, and particularly in recent years, again, kind of exacerbated by the COVID-19 pandemic. And so we've seen that overdose death rates have increased among people aged 35 and older, people who are male, and non-Hispanic Black folks. And so deaths involving opioids with and without the presence of stimulants have decreased among white individuals, but have increased among Black individuals. And you can see here, the kind of downtrend of opioid and stimulant deaths among white folks and an uptrend among Black folks. And deaths involving stimulants alone primarily impact Black individuals, but not exclusively. And so I think some key takeaways here. drug overdose deaths in Philadelphia are common. Fentanyl is increasingly present in overdose deaths, and deaths among Black individuals are increasing. And so now if we think a little bit about various neighborhoods in Philadelphia, for all of you Philly natives, you know, Philly is very identity based, based on where you live. And so you can see here on the left that overdoses are highest in kind of the Kensington area, which is likely unsurprising. Raven mentioned librarians getting involved with Narcan responses. And we've seen this a little bit in Kensington, but I think also really important to note is that overdose deaths occur throughout the city. And so while drug use may be most visible in certain parts of the city like Kensington, drug use is occurring and overdoses are occurring throughout Philadelphia. And it's important that we think about resources being distributed appropriately. And so this was an article that came out not too long ago, which I think is really, it brought to light something that is really important and often under talked about, but really thinking about how certain neighborhoods lack resources, lack evidence-based resources for people who use drugs. This article was focused on mostly Southwest Philadelphia, but really thinking about how marginalized communities often also don't have access to treatment, which we know reduces overdose deaths. And so I think it's kind of important to think about some really tangible harm reduction efforts. And so these can include things, and these can be really important in addressing overdoses in Philadelphia and across the country. And so Narcan or naloxone can reverse an opioid overdose, and it's worth noting fentanyl is an opioid. So naloxone can work to reverse an overdose that's caused by an opioid. Fentanyl test strips are also increasingly available in Philadelphia, and these can be used for people to test drugs before they use them so they know if fentanyl is present in the drug they're about to use. Clean syringes, as I mentioned earlier, also really important harm reduction supplies in overdose prevention sites. If you haven't already, I'd encourage you to kind of follow the case that's unfolding with Safe House, which is the proposed overdose prevention site in Philadelphia. There's currently a statewide Supreme Court case. There have been a lot of appeals since 2018 and kind of back and forth legally, and it's a really interesting case and a really important one. Evidence-based medications, those can also be thought of as harm reduction efforts. And so these could be medications like Suboxone or buprenorphine or methadone. We know these work really well for some people and reduce overdose deaths. And it's really important to make all of these more easily accessible to people who use drugs. And so I'm sure as many of you may be thinking, there are arguments, against harm reduction, and there are really big benefits to harm reduction as well. The evidence is there. We've seen good outcomes with all of those things I just mentioned, and with more initiatives. A lot of times, Canada and European countries are a little more progressive in their harm reduction approaches. And the US lags behind a little bit, but we're working on it. But I'm sure you can also imagine arguments against harm reduction. And I think thinking about, where would an overdose prevention site go, I think is a really important question. And, communities need to think about, what they want happening in their own community. And so now I'll talk a little bit about a program that I'm part of. So as I mentioned, I'm a member of Soul Collective, and Soul Collective is a Philly-based harm reduction organization. It's run by a group of individuals. We don't have leaders. It's really, truly a collective. We've partnered with Next Distro to offer a mail-based Narcan and fentanyl test strip distribution service in Philly. So people in Philadelphia can go online and fill out a form and be sent Narcan and fentanyl test strips for free, and de-identified kind of nondescript packaging. There's really no strings attached. And so it's a really cool program sponsored in part by the Philly Department of Public Health. And so Next Distro is a national nonprofit. It's an online and mail-based harm reduction service designed to reduce overdose deaths, prevent injection-related disease transmission, things like HIV, hepatitis C, and improve the lives of people who use drugs. And so just a little rundown of how the program works. So we mail free naloxone and fentanyl test strips to folks in Philly free of charge. In order to get this mailed to you, you'd watch a short naloxone training and fill out a web-based form on Next website. And then I would get the request. I'm the mailer, and I'll package the Narcan and the fentanyl test strips and I'll mail it out. And we get the Narcan and the fentanyl test strips from the Philly Department of Public Health. So it's really this really innovative and so far effective partnership to reach folks in Philly. And so packages include 2 doses of naloxone, a breathing mask, a pamphlet about Soul Collective and Next Distro, and information about fentanyl. And so this is what a package would look like. These supplies on the right would be included. And so I think one of the things I really appreciate about this event is it's very tangible. I think people are really interested in what we can do at a very kind of grassroots level. And so one thing that you can do is spread the word about, free Narcan and fentanyl test strips available in Philadelphia. It's worth noting that Narcan is also available at pharmacies. There should be a standing order, so you should be able to, there is a standing order in Pennsylvania. And so pharmacies are legally required to stock Narcan. They don't always, but you should be able to go into a pharmacy and ask for Narcan. Sometimes there are copays that are cost prohibitive. I think there's some recent efforts to kind of bring those costs down or have those covered. I'm not totally sure on those details. Just a couple of days ago, I think that came out. But for people where going to a pharmacy isn't feasible for any reason, it could be because of stigma, time, money, transportation. We really encourage you to go online and request Narcan, and if appropriate for you, fentanyl test strips as well. You can also always donate. Money is what keeps organizations like Soul Collective running. We do weekly outreach in the Kensington neighborhood of Philadelphia, where we provide safe injection supplies and safe using supplies to people. Project Safe is another organization that does a lot of really important harm reduction work. You can also advocate. So if you're not familiar with Safe House, as I mentioned, it's the overdose prevention site. Lots of advocacy is needed to kind of support this effort. There's also syringe services are currently illegal in Pennsylvania. One exists in Philadelphia at a prevention point, and there's a second one in the state in Pittsburgh at a prevention point there. Those are the only 2 syringe service programs in the state. So widespread legalization would be really key. And also decriminalizing syringe possession is a smaller incremental step, but that still would be helpful to really limit contact with the criminal justice system for people who use drugs. And I think it's also really important just to note that language matters. When we talked about stigma, stigma is perpetuated by language. So just really being mindful of the language we all use when referring to people who use drugs and even thinking about them. I think avoiding terms like addict or user, language that really doesn't center the person, I think can be really harmful. And the flip side of that is that person-centered language, maybe saying a person who uses drugs, is a much more, I think, friendly way to talk about these people. And so really, if we think about, what we want the impact of harm reduction efforts to be, it's to decrease opioid overdose deaths and really overdose deaths broadly. and to improve the lives of people who use drugs. And so that's all that I have for today, but I'd love if it's feasible to have a discussion if people have questions. And also you can feel free to connect with Soul Collective and myself on social media if you're interested. Thank you very much.
Thank you so much. That was super, super informative. Anybody at home who has questions, now's the time to ask. You can ask either using the Q&A format or the chat. I'll read both. So I have a question. So I'm living in Fishtown. For those of you who aren't from Philadelphia, Fishtown is technically within that Kensington area, and we border on the areas that are that have a higher density of people who use drugs. So we've talked among the neighbors association about putting things around the L line. So the L, folks who aren't from Philly, is like our train line that is a place where people gather who use drugs, generally speaking, in that area of the city. And we've kicked around the idea, and I don't know if we're allowed to do this, and I want to know if we are allowed. So people have said, we have little free libraries around the neighborhood for books. We have one that's specifically for cookbooks. We have another one that's just for kids' books. Could we have something in the same sort of spirit as a little free library, but that has, for example, fentanyl test strips? Is that legal? Can we do that?
Yeah, that's a great question. And I'm always so intrigued by these innovative approaches and ideas. And I think that's one that I haven't thought of and I haven't seen done, but I really like it. The legal space around drug use is actually relatively gray, at least in Philadelphia, because things can sometimes be illegal at a state level, but special provisions can permit certain things to exist at a city level. So the syringe service programs is an example of that, where we have one in Philadelphia and in Pittsburgh, but it's illegal at the state level. My hunch would be so fentanyl test strips, I should start by saying, are not FDA approved to be used to test drugs. So there was kind of a special provision in August of, I think it was 2021, so just this past summer, kind of I believe it was from the Secretary of Health in Pennsylvania, saying that they're not going to prosecute mailing fentanyl test strips, but I don't think it's still actually legal, but we do it. Okay. And so fentanyl test strips really aren't a tool that can be super widely distributed from health systems, but the Philly Department of Public Health has a lot of efforts to get fentanyl test strips out. And so I think something like the idea of the free little library would be great. I'm sure, I don't think there would be, prosecution against it in Philly. I also don't think it's explicitly legal.
Right.
So I think it would be towing.
So it might have to be something that we do as under the table, smaller group, as opposed to officially the Fishtown Neighbors Association.
Yeah.
Whatever.
Yeah.
Okay.
That's a great question.
Thank you. We've got a bunch of questions in the chat. The first one comes from Kathy Freimiller. Can you talk a little bit more about treatment options in Philadelphia for opioid use?
Yeah, sure. That's a great question. Thanks, Kathy. So I think I mentioned kind of briefly in the talk, so kind of the gold standard or so of treatment for opioid use disorder is with medications. Like methadone, which has been around for the last many decades, and the relatively newer buprenorphine, the brand name of that is Suboxone, and there's also another drug, the brand name is Vivitrol, the generic naltrexone. That's an extended release injection. Those three medications are evidence-based to treat opioid use disorder. They all look a little different. Suboxone you get from a pharmacy, like you would get other medications, and you can take it home. Methadone is federally regulated, has really tight regulations, and you have to go every day to a treatment facility. The mechanism of action of those drugs is a little different, so some people prefer one to the other. And then the naltrexone, as I mentioned, is a monthly injection actually, but I would say that one is the least utilized of those three. Methadone access in Philly is really tough because of the federal regulations. Only certain treatment centers that are like dedicated methadone facilities oftentimes can dispense methadone. And so really the treatment option that's most common in Philly is with Suboxone, buprenorphine. And so in certain pockets of the city, there are, fairly good treatment centers, treatment access for folks. The Northeast generally has some options, hospitals and health centers like Penn and Jeff. They have, solid access to Suboxone, but I think the number is something like only 8% of people with opioid use disorders access medication. So we really know that the supply of evidence-based treatment does not match the demand.
Right.
I think what's really notable though, thinking about access across the city, is that places like West Philadelphia, Southwest Philadelphia, North Philadelphia, South Philadelphia, those are all places where overdoses are going up. And we don't have treatment options there in the same ways we do in other parts of the city. And so I think we really should be thinking about how to build treatment centers and access to treatment in those settings, or maybe more innovative models like a telehealth approach.
Yeah. Awesome. Thanks for that answer. The next question is coming in from Ashley. For non-Philadelphia based people in the US, is there a way to find resources and organizations to help out and get involved with, or do you have any other recommendations?
Yeah, that is a great question, Ashley. So I would say one thing you could do, so Next Distro I mentioned is a national nonprofit, harm reduction nonprofit that we partner with for the mailing in Philadelphia. They partner with organizations across the country, with grassroots kind of like local organizations, to do this mailing. And so you could go onto Next Distro's website and kind of find your area, and they have pretty good coverage. And you could just look to see who the local group in that state or city is, and you could contact them. I think you can also maybe just Google like harm reduction organizations in the area where you live and see what comes up. I think harm reduction is a term that like attracts a certain type of thinking in organization. So if that's in an organization's kind of like tagline that would be searchable, that may kind of get you what you want. I think a lot of times it is challenging. Like Soul Collective, we just are like working on launching a website. So a lot of times, some of these organizations might not have websites or, super ingrained infrastructure. So sometimes just like messaging on Facebook or Instagram or like however on social media could be an approach to kind of reaching out as well. And happy to kind of think through that more with you if you want to reach out. I think you're muted, Sarah.
Thanks, I am muted. My cat was screaming and I just didn't want you all to have to go through that. All right, the next question is from Nate Parsons. Can you talk a little bit more about effective ways of countering groups with vested interests in not performing upstream public health harm reduction, the police, politicians, et cetera? And how do you push back against the narrative that drugs are equivalent to violence?
Yeah, that's a great question, Nate. And I think something that's like a perpetual challenge. I think one thing, that everyone loves is like evidence or data. And so the evidence for harm reduction is it's not like super clear in the literature, because a lot of these things happen, not in Philadelphia or not in, specific areas where you might be trying to change practice or policy. But there is really good evidence for things like overdose prevention sites in Canada and like Switzerland and other places. So I think, saying that these things work and save lives also can sometimes save money, can, reduce crime. I think, showing that, it's not drug use is, like trying to mitigate drug use probably isn't an approach that's like overly effective, and might even, some of these like more penalty driven approaches or, police driven approaches can lead to more crime. If you walk around certain neighborhoods, you'll see just kind of like police officers arresting people for seemingly no reason or, unfair treatment of people. And I think that can sometimes spur violence as well. It is challenging though. I think also just like talking to people, I think can be really helpful, and like not, sometimes it's really hard not trying to like come off overly biased. I think asking questions, I think personal experiences are really powerful. I know in Philadelphia, there have been some efforts to work with the police department, and they've been really receptive, from what I've heard, actually, having, like people follow police around and like document what's going on, and like trying to do some research to collect data on, how police officers engage with people who use drugs. And so I think maybe sometimes asking more open-ended questions too can sometimes get you to where you want to go, but it's not easy.
Have you found that some police districts within Philadelphia are more open to working with folks who are interested in harm reduction as opposed to others who may be more like old school in their thinking and more closed off to it? Like, is there hope in kind of poking holes in the broader Philadelphia region?
Yeah, it's a good question. I can't really speak specifically to different districts. I do know with like, the current leadership, I think is like, relatively open to thinking about more harm reduction oriented ways of responding. So like, for example, having like mental health professionals accompany police officers to certain calls. I think that's being kind of piloted in certain parts of the city. I think Kensington is one of those areas. Yeah, I think, probably finding sympathetic ears wherever you can, knowing that's not going to be true across the board is probably a good approach.
Thank you. Yeah. The next question, and I don't know what it means, but maybe you do, is also from Nate. How do you counter pushback from users over issues of biopolitics? Is medicalization of opioid disorder the way to go?
So biopolitics, I'm interpreting to mean kind of like the medicalization of, opioid use disorder, assuming that opioid use is bad or substance use is bad. If the person who asked that question wants to chime in, you can feel free. But I can speak to that a little bit of this idea that we have that like drug use is inherently bad and something that needs to be fixed by the medical system. And I think this is largely untrue. I think, the idea that like you'll use drugs once or you'll use heroin once and you'll be addicted for life. I think we know that something like 30% of people who try heroin will become addicted. And so really the vast majority of people won't. And so why then is the narrative that all drug use is bad and that it always leads to addiction? And then once we have addiction or use disorders, we need to treat that within this medical model. And so I think there is like a lot that can be gained from like peers in recovery, people who have lived experience with substance use disorders, or who just have experience using drugs and like incorporate that as part of their life. I think there's tons to be learned, among peers. And I think that's a model that we're seeing in Philly, being tested in some health systems and being used. I know Penn is using, certified recovery specialists is what they're called in Pennsylvania, but, just peers in recovery, like as part of the care delivery model. But I think also just community organizing and community activism is really important too, and often undervalued and under kind of appreciated and highlighted too. Like, I think we don't hear about that as much as we do maybe, certain medical models of thinking about drug use.
Thank you for that. So the next question, could you point us to where we could find the training for the Narcan/naloxone, so that folks who are at this call could go and get that training and maybe either get the naloxone or get it from their local pharmacy? And do you also know like how much, I know you said it varied pharmacy to pharmacy and insurance to insurance, but like ballpark, how much would that cost to have naloxone on hand?
That's a good question. So I just put in the chat the link to watch like a training video and to have Narcan. And if you also want fentanyl test strips mailed to you, It's a great question about the Narcan. So Narcan without a prescription, I think, is typically around like $150 or $200. So Narcan is the brand name. It's the nasal injection.
Gotcha.
Naloxone is the generic name, and that typically comes in like a little vial, and it can be injected intramuscularly with a needle. So, most people are more comfortable with the nasal version, but the naloxone is much cheaper. And so like when you're getting it from like the Department of Public Health or something, sometimes, it is nice to use the intramuscular variety if you're comfortable with that. But whatever people's preferences are is good. But so with insurance, I think it can really range from like, maybe $10, maybe like $40, none of which is like insignificant. And when you think about like the likelihood of you using the Narcan, hopefully is, non-zero, but relatively low. And so I think it's a really hard like behavior change to make to pay money for this thing that, has the potential to save a life, but at the same time, you have to carry it around. And I think that's one of the things that we really ask of people who do request Narcan from us is that it doesn't just sit in a drawer and have like no chance of being used. So if you do, carry it around, have it in the bottom of your purse or a bag that you carry, so that if you did encounter someone when you're out and about, if you're, on the L, if you're, walking around and encounter someone who might have overdosed, and you can kind of see in the training video that you'll watch how you would identify that, that you could actually use it. And one other thing I'll mention, the Philly Department of Public Health also has a website where they hold like periodic Narcan trainings that are a little more expensive than what we offer online. So if people are interested in that, that's an option as well.
Cool, thanks. So is there then like not really a big concern about it like going bad? Like you can just like throw it in your backpack, and if it's in a hot car for a while, that's okay. Like,
yeah, that's a good question. So temperature, actually, it is ideal to like have it fairly temperature regulated. So like we don't recommend leaving it in your car. Yeah, so heat and cold aren't great, but the expiration, there was like this really interesting study done where like they tested the percent of like the active ingredient in Narcan at like 5, 10, 20, and like 30 years after expiration.
Yeah.
And I think at like 20 years, there was like 99% of the active ingredient still in the Narcan. So expiration dates are largely a product, I think, of like pharmaceutical marketing and like wanting people to, buy new drugs. So I think Narcan especially is good to carry around at least, a couple years after expiration. So if you have expired Narcan, don't throw it away. If you don't feel comfortable carrying it, you can give it to like a community group. We like at Soul Collective keep expired Narcan, we'll collect it and, distribute it as appropriate. So yeah, that's a great question.
all right, the next question is, let's say, you're not a drug user, but you live in Kensington, or you live in an area around the country where there are a lot of drug users that you encourage on, or not encourage you, that you encounter on your day-to-day life. Let's say that you're relatively financially stable as well, and so you may not need to get it from Next Distro. Do you then go to the doctor and just explain that? Like, is that how you get the prescription? Because you're not the drug user, so it's not for you, right? But like, what is the procedure in this situation?
That's a really good question, Sarah. And I should have made this more clear. So you don't need a prescription from a doctor. So because there's a standing order, so the Secretary of Health in Pennsylvania like signed something that said anyone in Pennsylvania can walk into a pharmacy and just get Narcan without a prescription. And so in theory, you should be able to walk into any pharmacy in Pennsylvania and for that to be true. But it's actually great if all of you will walk into your local pharmacy and ask them if they stock Narcan, because they should. And if they don't, maybe I think they're actually required to log every time someone asks about it to kind of show, some sort of metric. And I think it can help them stock it a little more. But so in theory, you can just go to the pharmacist and say you want Narcan. And, sometimes a lot of stigma can be endured during this process. Different pharmacists have different thoughts, personal beliefs about drug use. And so, sometimes there's like a great experience of like some education about when to use Narcan, what it is. maybe some questions about, like, do you feel comfortable administering it? But sometimes there can be certainly some judgment too, and that can be a deterrent. And that's something that I think is these pharmacy level barriers to Narcan access is something that we really need to think about addressing.
For sure. And so even if you don't have a prescription for it, your insurance may still cover it.
Yeah.
All right, sweet.
Yeah, because in theory, we all have a prescription for it, even though.
Right.
Yeah, but that's a great question.
Sounds good. The next question is from Ashley. Is distributing Narcan / the fentanyl test strips legal in the US, or does it depend on what state you're in, the locality, et cetera?
Yeah, that's a good question. So it does kind of depend on the state. And so like the legal piece is like, important. And I think also knowing about, what actually gets prosecuted is important as well. So when we started mailing the Narcan and fentanyl test strips, it was technically still not legal. But so like in Philadelphia, Larry Krasner, the DA, has said that he's not going to prosecute these things for the distribution or mailing. And so while it wasn't technically legal, it was still something that we felt confident doing. I think, other states have really different landscapes. And, I'm a nurse, I have like a professional license. And so thinking about the ramifications of if something did happen legally, everyone has reasons that they don't want to be involved with, a messy legal case like that. But I think it is really state dependent and also kind of like context dependent as well. And I think ideology plays a fairly large role in that.
We've got a question related to that from Nate. Does Pennsylvania have a Good Samaritan law, or could you be legally responsible for administering Narcan?
Yeah, that's a great question. So Pennsylvania does have a Good Samaritan law. So meaning that in theory, if you, call 911 about, using drugs or anything related to drug use, either you or the person using should not be charged with, anything. But I think sometimes it isn't always the case. And we see these really unfortunate situations of people, doing the right thing and calling. And, it might not be like exactly falling within the Good Samaritan law, but sometimes there could just be people who are around and associated with a person using drugs, or maybe they use drugs themselves and are there when the police respond to an overdose. And sometimes there can be kind of these legal tie-ups. So the law is good. It's imperfect and imperfectly applied, but it's there in theory.
Sounds good. Thank you. The next question, clean syringes and that sort of thing are readily available where I live for drug users. Some folks in my area keep bagged lunches for unhoused people in their cars or on them. Is it reasonable or a good idea to have a little kit with Narcan / fentanyl strips, et cetera, in case you encounter someone who needs the products in the same way that you might do food?
Yeah, that would be awesome. And so I think, that's like on kind of like a micro scale, what we at Soul Collective try to do on like a weekly basis is we make these little kits, and it can be, things like safe snorting or safe smoking or safe injecting supplies. It can be like wound care supplies, fentanyl test strips, certainly. And so those are things we just hand out to people who indicate some sort of interest. And I think, one of the things that is important is, thinking about how we like identify people who we think might be in need of these things. And so, important to think about not profiling people and really letting people ask or show that they're in need of help or support in some way. I think is really important. But I think that would be awesome, Ashley. And, maybe just like getting your hands on those supplies is a potential challenge. But I think, if you request through us, or, I'm sure there are opportunities through PDPH, the Department of Public Health as well, for maybe getting some of those supplies to distribute.
This is sort of related to what you were just mentioning about asking, like waiting for people to ask if they need help, basically. But this is a question from Rose. What indicators for drug use are there to watch out for among your friends and family? Are there any signs that indicate that immediate treatment is needed? And are there any other things that like we should be aware of in our community?
That's a good question. So I think, drug use can present so differently. And as we kind of talked about, drug use is not synonymous with like problematic drug use or a substance use disorder. And so I think, we think about use disorders when there are components like not being able to like enjoy time with friends or family, or not being able to carry out responsibilities that you might be used to carrying out. Making decisions that can put yourself or others at risk. Those are kind of some of the components when we might think about a diagnosis of a substance use disorder. But I think, signs can present differently. I think open-ended questions with friends or family members is always a great place to start. And I think, so treatment is something that loved ones often want for people with substance use disorders, but oftentimes not what the person with a substance use disorder wants or feels ready for. And I think a really important part of harm reduction is recognizing that someone might not be at the place where treatment would be helpful. And so treatment could be with something that's, evidence-based, like medication for opioid use disorder, like buprenorphine or methadone. It could be something like detox, which we know largely is not effective. But still happens a lot. It works for some people, but really on the whole isn't an effective treatment approach. It could be something like intensive outpatient treatment, which we know, can work for people as well. But I think all of those things require, the person with the substance use disorder to be in a certain, headspace and, readiness to change stage. And so, if someone's not ready to stop using substances or limit their substance use, then I think, maybe treatment isn't the right thing in that moment. And maybe the question should be, how do we keep this person alive and safe until maybe they're ready for treatment, or maybe they won't ever be.
Raven, take it away. Oh, you're muted.
All right. Another question from Ashley. Are there any statistics to combat the stigma, such as violent drug users, to encourage and advocate for harm reduction practices to be used, specifically in regards to having safe houses and people not wanting groups of drug users around them?
Mm-hmm. So yeah, I think you get at something really important, Ashley, is like kind of the NIMBY approach that we've seen really strongly with safe house, especially. So, not in my backyard. So maybe something like an overdose prevention site like Safe House. There is evidence for them. There's really good evidence, a lot of it coming out of Canada, to show positive outcomes associated with overdose prevention sites. So in Canada, I think there were like no overdoses among the kind of cohort of people examined, proximate to overdose prevention sites. There was like reduced infectious disease transmission with diseases like HIV and hepatitis C, like increased quality of life, I believe decreased crime. And so there is some evidence there. I think it is really hard though to kind of think about how we get at the stigma of kind of people who don't want, their kids walking by people using drugs. I think that's when we hear a lot. Obviously I think it's very nuanced, but I think thinking about kind of, community good and thinking about things a little more holistically is important, and also really thinking about overdose prevention sites as a community asset instead of a community drain is a way to reframe all of our thinking.
Great. Is there anything, so we're coming up on 8 o'clock here. This has been such an amazing conversation. Thank you everybody for coming and asking all of your questions and bringing your curiosity with you. Rachel, is there anything else that you'd like to share with us before we wrap up here?
Oh, I think this is so great. Thank you for all of your questions. And yeah, please don't hesitate to reach out if you have thoughts or other questions or want to connect offline.
Awesome. Thank you so much for taking the time. Raven, thanks for the free library always working with us. And hello, free library people who are watching on their YouTube or Facebook live stream. Thank you, Ruth, for signing for us. And folks at home, we will be doing this again in November. The date is TBD, so just keep checking up on skypeascientist.com under the events tab for an update there. In November, we're going to be talking with a scientist named Mike Hogan. He is at the University of Pennsylvania, and he was actually the first, he was among, like, in the group that did the first experiment injecting mRNA vaccines into an animal. Like, that guy was on the forefront of mRNA vaccines, which now obviously saved all of our collective butts the past 2 years. So Mike is going to talk to us about what mRNA vaccines are, why they're like, why they came about so quickly, why we can make them so fast, and any other questions that you have about vaccines. So we'll specifically probably focus on mRNA vaccines, but we'll touch on some other stuff as well. We'll keep that, we'll send you information about that when we get it. Thank you again, everyone, for coming. If you're able to support Soul Collective and the other groups mentioned, the links are in the chat. Please do. Also, if you can support Skype a Scientist, we would really appreciate it. You can do that at patreon.com/Skype a Scientist, or on our webpage, there's a button to donate at skypeascientist.com. We'll see you all next month, and thank you all again for coming.
Thank you all. Have a wonderful night.
Thanks, Raven. Bye, everybody.